Okay, it's 1 o'clock, so we'll get started. Hi, everyone. I'm Stephanie Black, the Director of Continuing Education for the Ontario Shelter Medicine Association. Thank you for joining us today. In the spirit of working together while keeping our distance, this webinar is a joint effort from the Ontario Shelter Medicine Association, Association Vétérinaire Québécoise de Médecine de Refuge, and Humane Canada. This meeting is generously sponsored by Ogena Solutions, so huge thank you to Ogena Solutions. Ogena Solutions was formed from the company Anavac Corporation, which was created in Canada in 2005. Ogena Solutions is dedicated to providing complete, effective, environmentally friendly biosecurity solutions, equipment, and protocols. They also have patented groundbreaking animal bathing systems. Besides being the exclusive master distributor for Virox Technologies' accelerated hydrogen peroxide disinfectant products in the Canadian animal health sector, Ogena's own equipment, products, and matching usage protocols are respected as being the best and most efficient products available in animal health today. Ogena currently operates in the animal health sector, including farms, shelters, veterinary facilities, pet boarding, and daycare applications. Biosecurity, green technologies, and leading-edge bathing solutions are central to the company's product focus. So thank you again to Ogena Solutions. A few housekeeping items before I introduce our esteemed speaker, Dr. Weese. He will give a presentation followed by a question period. Questions can be asked in the chat window, and we will ask them on your behalf at the end of the lecture. Please keep your microphone muted throughout the presentation to avoid feedback and background noise. Now to introduce our speaker, Dr. Scott Weese. Dr. Weese is a veterinary internal medicine specialist and the Chief of Infection Control at the University of Guelph's Ontario Veterinary College. He's an expert in infectious and parasitic animal diseases, including rabies, tick-borne diseases, antimicrobial resistance, and emerging diseases. He is the former Canadian Research Chair for Zoonotic Diseases. As many of you know, he's been at the forefront of this pandemic and its relationship to veterinary medicine. For those of you that aren't aware of his Worms and Germs blog, I recommend you check it out today. Please join me in welcoming Dr. Scott Weese.
Great, thanks a lot. So today, obviously we're talking about COVID. What I'm going to do is start off with some slides. It's going to jump around a bit because I'm trying to kind of address the main questions that keep coming up. It's not going to be the overall overview of COVID because I think everyone's had a really good crash course in coronavirology over the last few months. So I want to focus on the issues that are pressing now. When it comes to things we need to worry about with this virus, things that are impacting how we change, how we work, and changes that are happening as things start to open up. And one of the take-home messages really, this is a long-term venture. Like, this is not a sprint, it's a marathon. I think people keep saying that, and we need to remember that. And I'll explain that a little bit more later on. Slides moving here. Okay, so I'm going to start off just a really quick overview of what we know about animals and the animal risk component, because when we're talking about this, there are various levels that we're concerned about with this virus in shelters. One is infection of animals from an animal health and a human health standpoint. The other is contamination of the hair coat. Animal comes in, is there a risk they could be carrying this virus? And then there's the broader implication, which is the impact of all the control measures on shelter operations. Now, ultimately, this is a human disease. It's a zoonotic disease. It started off in bats, however, got to people we don't really know, but it's predominantly, if not exclusively, spread human to human. But there are some potential animal aspects we have to pay attention to, and we just don't know how big they are. So dogs are pretty low risk for this virus. We know that dogs can be infected in a small number of circumstances. There have been a few reports of dogs being infected, and there's been experimental studies showing that dogs can be infected. They're not very susceptible to this virus, and they don't seem to get sick, which is good for the dog, but if they can be infected and healthy, that still raises some public health concerns. So they're not very susceptible. You can get occasional human-to-dog infection. They get infected for probably just a few days, and then they get rid of the virus. Whether they can pose a risk to others is the big question. So experimentally, dogs weren't able to pass it to another dog. It was a pretty small study. The fact that they have live virus on them raises concern, but what we're hoping is they're a dead-end host. So yeah, they can be infected, but they don't have a lot of virus on them. not enough to infect someone in normal circumstances. We just don't know that yet. But dogs, we're paying, we're less concerned about dogs than we are cats. And we're worried about cats because they are quite susceptible, reasonably susceptible to this virus. Experimentally, in a natural infection, we know they can get infected. Probably most of the time when they get infected, they don't get sick. And it's probably similar to people, right? A lot of people, if not most people, they get exposed to this virus and they get infected, they get an asymptomatic infection. We get a similar thing in cats. Most people that get disease get mild disease, probably similar to cats, and some get serious disease. And we don't know if that actually happens in cats yet or not. We're still working on that. So senior cats, cats with other health problems, we are still concerned that there might be serious disease there. But from a cat health standpoint, it probably causes, fairly typical upper respiratory tract disease and diarrhea and vomiting. So, relatively mild disease, but relatively, very similar to things that you see in shelters all the time, which becomes a problem because is a sneezing cat, a typical sneezing cat, or does it have COVID? It's the same with a cat with diarrhea or a cat vomiting. So we know they can be affected. We know they can be affected from owners. And we also know that cats can spread it cat to cat. And if they can spread it cat to cat, obviously raises concern they can spread it cat to person. We just don't know if that happens. And so we're worried about cats in households with affected people. We're also worried about colony cats and feral cats, because what we really don't want to have happen is a caretaker, infect a colony of cats, both from a cat health standpoint, but probably more concerningly from the public freakout standpoint. If you hear reports of infected stray cats in a city, there's probably gonna be a call to cull the animals. So we're really working at things overall. What we're trying to do is reduce the exposure of animals to infected people, so we don't have to worry about the animal aspect, because we don't really know what that aspect is. Now, ferrets are kind of like cats. They're more susceptible. So ferrets are quite susceptible to this virus. They can get sick. They can spread it ferret to ferret. Can they spread it ferret to person? It's hard to say, but it's quite possible. They have a lot of virus on them when they're infected. And we know that mink, close relative to ferrets, there have been outbreaks in a number of mink farms in the Netherlands. Human to animal exposure initially, but then mink can pass it along and can get sick. They can get respiratory disease. They can get intestinal disease like vomiting and diarrhea. So that's kind of the rundown of the main species. Once we get beyond those main species, we don't know as much. Rabbits, are rabbits susceptible? Maybe. We don't have a lot of data on that. A lot of the small mammals, are they susceptible? Hamsters are, we know, experimentally. Rats and mice seem to be fairly resistant to it, but we just don't have a good handle on the scope of infection. So from a clinical standpoint, this kind of ties into evaluating animals when they come into shelters. Dogs is unlikely to occur. Disease is unlikely to occur. If a dog's coughing, it probably has our normal cough causing agents. It doesn't likely have COVID. Cats, and this is the challenge, right? Because a cat with this disease is most likely going to have an acute onset of fever, lethargy, maybe decreased appetite, respiratory signs, coughing, sneezing, and or gastrointestinal signs, vomiting and diarrhea, which, as you know, are exceedingly common, very big presentations. And that becomes a challenge because, most cats with this type of problem aren't going to have COVID. If they've been exposed to someone that has COVID, well, then it gets higher on the list. We have to be concerned about it. And ferrets, kind of similar to cats. I'm going to come back to some risk things in a little bit. But I want to get this in. This is a really important talking point. I think it's a message we need to keep getting across. And if you're talking to people that are worried about it, talking to people that are talking about surrendering their animals, it's really important to put this whole disease into perspective. Like I said at the start, this is a human disease. It can spill over into animals, but right now it's a well-adapted human pathogen. I'm much more worried about getting this from a person than I am from an animal. And I have no concerns at all of getting this from my animals. Because if my animals have this, they got it from me, or they got it from someone in my family that's more likely to infect me. So that same message for your average owner. If someone is freaked out about their cat giving them COVID, well, if they keep their cat inside, their cat is not bringing this virus into the house. If we socially distance our animals such that they don't have contact with other animals or other people, they can't be an index case. So it's a person that's going to bring it into that household. It's a person that's going to pose the risk. So that brings in a couple of concepts. One is just socially distancing the animals, keeping them away from other animals and other people. And the other is just balancing that concern. So if someone is really freaked out about COVID, there's some really basic things we can do to say, don't worry about your cat. Your cat's not going to be the source. And that just comes down to social distancing, which is the main message we have all the way across. So what are the main pet associated risks? Well, for your average owner, they're basically, or if they do some common sense things, there are no risks. Where the risks come in is when animals move and they encounter different individuals. And that gets into situations like vet clinics and shelters and groomers and boarding kennels. That's where the zoonotic risk actually starts to come in, because, if I've infected my dog doesn't pose a risk to me because I'm infected. Or if my wife infects my dog, well, she's a greater risk to me than my dog. So if I take that dog, though, and I take it to a kennel or to a vet or goes to a shelter or somewhere else where it encounters someone new, then we bring in that potential risk. So in situations where we can't socially distance the animal and can't restrict them to their household, then that becomes a concern. So we're worried about animals tracking this out of the household. And that's, clinics, shelters, kennels, and the like. That's also encountering feral animals and wild animals. And the indoor-outdoor cat can have contact with a feral cat or a neighbor's cat or a TNR colony cat, and then spread it. And then there's also the wildlife component. And we don't know the susceptibility of our wildlife species. We assume it's low for most of them. But there is still a fair bit of concern because we don't want this getting established in things. Imagine if this gets established in raccoons in Toronto. Like, there's so many raccoons in Toronto, this could be a self-perpetuating reservoir. We don't want it to get into bats. So there's a lot of restriction in bat research that's being done. There's a lot of restriction in wildlife research in general that's going to be done in North America this year because we don't want to take the chance of exposing wildlife. And I think that should be a consideration when we're talking about colony cats, is not saying we don't do anything with them, but we minimize that contact and we maximize the prevention that we use in that contact with personal protective equipment, with making sure people are healthy and things like that. And we'll come back to some of those preventive measures in a bit. Question that comes up a lot is surviving the environment. So this is relevant for shelter infection control. This is also relevant for the animal's hair coat. Because if I have an animal that's exposed to someone, I'm worried about two things. I'm worried about that animal being infected. So the virus is living in it, and it's reproducing, and it's shedding that virus. But I'm also potentially worried about it being contaminated. So I have COVID, and my cat's walking around my lap, and I cough on my cat, or I pet him with dirty hands. Have I deposited a virus on his coat? Well, probably. How long does it survive there? No idea. It's not a very tough virus. We know it can live 2 to 3 days on some surfaces, plastic and stainless steel, which isn't what our critters are made of. So it probably only survives, minutes to hours on a hair coat, but it is a potential concern. So you've got a surrender, or you have someone coming in for healthcare into a shelter. If the owner's infected and they handle that animal right before, and you're handling it, 10 minutes later, an hour later, then there is a theoretical risk there. And this ties into the concept of really trying to understand the human risk associated with that animal. We're focused on, screening the animal risk. So, is the dog coming in with diarrhea, is the cat sneezing? But we also have to think about the human risk associated with that animal as much as we can. We can't with a stray, you can with a surrender, you can with the one that's coming in for healthcare. Trying to screen situations where the risk is higher that a person has infected that animal, or a person has contaminated that animal, or a person might expose you directly if they're coming with the animal. So can animals be fomites? Can they be mechanical vectors of this? Probably. It's probably very low risk. And again, it's not in the household. It's not someone being afraid of their cat's hair coat if that cat's staying inside with them. It's when we move animals between areas. So if someone's sick and they cough on their cat and I handle that cat 10 minutes later and then I touch my face, well, there's a theoretical risk there. It's not something we get too freaked out about, but it's something that we have to pay attention to because we don't have much evidence. So this is where the risk assessment comes in. And, it's something that we do, I think, with every animal we see, or we should do with every animal we see. And sometimes it's just a matter of, okay, is it a diarrhea? No, I'm not too worried about that. But, as the shelter comes in, does it have diarrhea? Does it have a cough? Does it have anything that would indicate our typical infectious disease? There's skin lesions. For COVID, we just take that a little bit differently. So we can think about 3 different areas in the risk for this animal. So the household on the left here. So is it a known COVID positive household? High risk. Is it a household that has respiratory disease that's not known to be COVID? Well, it's still pretty high risk because especially as we move out of flu season, if you got someone with acute respiratory disease and fever, we've got to assume that it could be COVID. Is it an animal that has an unknown origin? So it's a stray. Or is it from a known healthy household? It doesn't mean no risk because a lot of people get infected asymptomatically, but it's lower risk overall. So we never say no with anything that we do. We're trying to get gradations of risk. So we can go from high risk to low risk. If we look at the animal, ferret would be number 1 in terms of risk. Cat would be number 2. Dog and others, pretty low risk. We can't say no, but they're low risk. And then the individual animal's health status, if they have acute respiratory and GI disease, they're high risk. So if you take a ferret or a cat with acute respiratory and GI disease and it's coming from a known positive household, that's a holy crap, it might have COVID moment for me. I'm going to handle that one a lot differently than a healthy dog from a healthy household, or even a dog that's got, just GI disease, comes from a low risk household. So low risk species, it's just got one of these components. Maybe we've got an explanation for the diarrhea and we don't have known exposure. Well, it's a bit higher risk than baseline, but it's not that necessarily that big a deal, and I may not handle it all that much differently, or I'm not going to handle it differently than I would for a dog with diarrhea, which is going to be different than a normal dog, but I'm not going to bring in extra COVID things. So I think we don't need to have 100 different scenarios. You don't need every different permutation of this. We need to think about what are our highest risk situations, what are our next risk, and then come up with different approaches. And I'll hit on that in a little bit, but this risk assessment is really important. So we're looking at the animal, we're looking at where that animal came from, its household or its lack of a household, and we're looking at that animal's health status. So if we're thinking about managing exposed pets, we need to think about what exposure means. So exposure, it's a bit of a moving target. We're going on the assumption that animals, if they're infected or exposed, do things similar to people, right? If you get infected, a couple of days later, you might become infected. You might have the virus, growing enough inside you, then you might get sick shortly after that, and then you stop shedding the virus in a reasonable period of time. So we're kind of using the same general windows for animals there. So what's exposure? Well, exposure is contact with a known or suspected person. It doesn't get every situation because of asymptomatic infections, but it gets us thinking about it. And then for a species that's susceptible to the infection, I kind of consider the last 14 days. So if it's a cat and it's been exposed to someone in the last 14 days, I consider that cat exposed and potentially infectious. If it's a species not known to be susceptible, then I'm not worried about infection, but I'm still maybe worried about their hair coat. So realistically, it's probably only a day I'm concerned, but we've said 3 days just to give us a bit of wiggle room because we don't know how long this virus survives. So let's think about the situation we're worried about, right? So if it's a susceptible species, I'm worried about it being infected or its hair coat being contaminated. If it's not a susceptible species, I'm just worried about its hair coat. And that's why we have 14 days and 3 days. So understanding that animal's risk where it's been is important, as well as in the shelter, right? So if the animal's been in the shelter and you have no evidence that you've got COVID transmission in people in the shelter or between animals, once it's been in the shelter for 14 days, it's good to go. And your fosters, if you know that your foster household is healthy, it's been in that household for a while, all we're worried about is the foster exposure. And if they're healthy, the risk is really, really low, as opposed to an animal that comes in with no history and then it's being adopted out within a day or so. We've just got increased risk there just because we have less information. So what do we do with a potentially contaminated animal? Well, keep them out as much as possible. This is where the discussion comes in. So someone's freaked out because, they've been diagnosed with COVID or they're worried about COVID and they're freaking out about their pet. Well, the best thing for their pet is to stay with them because they've already exposed them. And again, this is human to animal more than animal to human, especially in the household. So if we can prevent them from coming in, prevent them from surrendering, or if they're coming in for healthcare, depending what you do in your shelter, if we've got a high risk situation, keep them in the household if we can. So time, even if they are infected, if we keep them there, let everyone burn this virus off together, we're good to go. If we have to bring them in, we start thinking about what we can do in high risk situations. So from a contamination standpoint, if I've just deposited a virus on my cat's hair coat, well, I can potentially kill that. So if they have to come in, it's coming from a high risk area, or we're worried about coat contamination, well, we can do things topically to the animal. It's a wussy virus. Bathing will kill it. Soap will kill it. Washing it off will kill it. Using a disinfectant wipe on the hair coat, using a disinfectant rinse. All these things, we don't know how well they work with this virus, but it makes sense that they would work. So if the animal is coming from a high risk environment, so you've got someone that has died of COVID, or they've gone into the hospital with COVID and they've got a cat, and that cat's being brought into the shelter, it's not unreasonable to think about a hair coat decontamination step. Or you chuck them in a cage, you don't touch them for a couple of days, we don't have to worry about that too. So a combination of limited handling and maybe hair coat decontamination. Is it necessary? Don't know. There's not really a downside to it though. So it's something you can think about. I wouldn't do it in every animal. And it's certainly not something we're telling people to do in their own animals because we don't want them screwing things up and using like concentrated bleach solutions. But for situations where an animal is going from a high risk area to a low risk area, such as from a positive household to a shelter or a clinic, it's not an unreasonable step to consider. With the potentially infected animal beyond that, well, it's really straightforward. So then again, in the scenario, the owner's died, and now the family's surrendering the cat. So isolating it. So that stuff, if it's a species that's susceptible, so if it's a cat, if we isolate them for 14 days, then we can largely negate the COVID risk. And along with that, using enhanced personal protective equipment. And I'll come to PPE a little bit more. I put testing here in brackets just because everyone asks about testing. We have access to testing now. There is a pressure not to test because we don't want just a lot of routine testing, because that involves sampling an animal. And it doesn't impact what we do with the animal from a health management standpoint. We don't treat this disease specifically. And from a shelter standpoint, if an animal comes in from a high-risk household and you take a sample and it's negative, I'm not going to say don't isolate it. I'm going to say it's interesting, it's lower risk, but I'm not going to trust one sample because we don't know the kinetics of shedding. We don't know optimal sampling sites. And sometimes we just get bad samples. Getting a good or pharyngeal swab from a cat can be a challenge sometimes. So we're never going to trust a negative. A positive is a positive. A negative means maybe negative. So you can't really bring in testing as a way to shorten isolation periods or say we don't need to use personal protective equipment. So this is a document, Stephanie mentioned our Worms and Germs blog, and this is also sent out through the Ontario Veterinary Medical Association. I think maybe this Canadian Veterinary Medical Association. This is a document we put together for reopening clinics, basically, or moving to the next phase. And most of this stuff applies to shelters too. It talks about social distancing and things that I'll come back to. We also have this table in here, which kind of brings in different scenarios and different personal protective equipment. So, an aerosol generating procedure. So someone asked about things like dentistry and intubation. Aerosol generating procedure in an animal that can be infected by SARS-CoV has been in contact with someone that might have SARS-CoV-2. So that's a high risk situation. So we've got gloves, N95 mask if possible, or at least some degree of mask, face protection. So this is the high risk going whole hog on PPE versus, a healthy animal is no known exposure. Just our routine PPE is probably fine. So in your shelter, it's good to have your lady copy this or you make up your own. Here are the different scenarios we have, and here's how we're going to handle those animals. I just want to mention masks because masks there's a lot of confusion about masks and a lot of questions about masks. And this will tie into some of the routine PPE use that I'm going to mention a little bit later. So masks are becoming fairly ubiquitous. And there's some good reasons for that. The messaging about masks has changed quite a bit. But the key thing about masks is to think about why they're being used in any specific situation. Now, there are two reasons we use masks. One is to protect the user, and one is to protect from the user. So if we look at surgical masks, so go back to surgery is an easy one for people to think about. So the reason to wear a mask in surgery is so that when I'm talking and breathing, I'm not depositing droplets and aerosols onto that patient or onto that surgical table. It's protecting the patient from me. If we have a cloth mask, same type of thing. So people that are walking around with a cloth mask or a surgical mask, it's not really designed to protect them. It's designed to protect people around them so that they're not liberating these droplets. And these droplets are the main infection concern. It's that short transmissions for these little drops that you liberate when you breathe and talk. Protects you a little bit, but these things don't fit very well. They're not a high filtering mask. The most effective component of protection of the user probably is they prevent me from touching my face. So if I contaminate my hands, I don't touch my face and my nose. But these masks are designed to protect from the user. N95 masks are the other main masks you'll see. These are efficient filtering if they're worn right. So if they're fit tested and they're worn properly, they will protect the user. But if you're using them to protect you, you also have to protect your eyes. So an N95 mask isn't what we're recommending for normal situations if we're trying to protect everyone from each other. So we're trying to protect people from liberating these droplets. Surgical mask or cloth mask is fine. And the other thing about the N95 masks, if you've seen them, some of them have this little plastic piece in the front. It's an exhalation valve, and it's there to make it easier to breathe. And those are completely useless when it comes to protecting everyone else. So people are walking around with those thinking they're equivalent to a cloth mask while they're protecting themselves. But when you breathe out, it doesn't filter the air. So if you've got an N95 mask with a filtration thing on there, it's not protecting people around you. So if you have a policy in your shelter that everyone's wearing a mask, or everyone's wearing a mask when they're within 6 feet, you don't want anyone wearing one of those N95s because it's not achieving the goal that you want, which is keeping those droplets and aerosols within them. Some N95s will do that. If they don't have an exhalation filter, an exhalation valve, then it protects going in and out. But we try to reserve N95 masks for high-risk situations and for human healthcare. So it's surgical masks and cloth masks are the main things that we use. And since surgical masks are still short supply, cloth masks are the standard for routine use. So routine use, sorry, we got clinics here as well. It's shelters as well. So what we do in our clinic is we have mandatory cloth mask use. So because we can't maintain social distancing all the time, we just know it's impossible in the clinic. You turn the corner and someone's there, you're doing procedures. We bring in the option for a face shield if we're doing a really close contact procedure, but we're bringing masks all the time and then bringing face shield in for those really close contacts. So the masks, again, that we're wearing all the time is for everyone to protect them from everyone else. It's a population tool. Everyone's got to do it if it's going to make sense. They're easy, they're cheap. You can probably get volunteers to make up a pile of masks for you. So there's something to think about using in your shelter, either as a routine thing or in situations where you're not maintaining that 6-foot barrier. And I'd say there's more pressure towards using them as a routine tool because it's hard to predict in most shelters when you're going to cross paths with someone. You know, you turn around the corner, someone's standing there, someone's coming the opposite direction. That's not when you're going to pause, pull your mask out and put it on. That's where having the mask on, if you're out in any kind of general area in the shelter, it makes sense. You're in an office by yourself, take it off. But it's something to think about. And again, it's one of our population protection tools. Just one more comment about PPE. This doesn't really relate to what I was saying before, but we've had a lot more emphasis on using PPE, obviously. And it's a good reminder that PPE is only protective if you use it right. And it's very common for people not to use it right. Part of that's not putting it on right. You know, people, when you're walking around out in public and people aren't, the mask below their nose, something like that. That's obviously a PPE fail. What we see more commonly in a better educated population, like a shelter or a clinic, is people contaminating themselves by taking it off. So, I've put my gown and gloves and everything on right. I've worn them all right. Now I'm taking it off and I contaminate myself in the process. So it's just a comment that it's always good to think about PPE. Most people don't. It's a good training exercise. Get someone to put on a gown and gloves and a mask. And then if some people stand around and watch them take it off and watch where they contaminate themselves, it's a good educational thing. Because if we're going to use PPE, we're going to spend the money on PPE, I just want to make sure we're using it right. Okay, so this kind of sets the scene for where we go from here. So we've got concerns with animal risk and animals as fomites, and we've got bigger concerns about people. So that's people coming into the shelter, that's workers in the shelter. And one of the points we're really trying to get across, which you've probably all heard ad nauseum, is this is a long-term venture. So, we've got a reasonable number of cases. 71,000 reported cases is a lot of cases in Canada. That's a lot of sick people. And it's an underestimate, so the number is even higher. But the point to emphasize with this is, we've got a lot of people in Canada, and 71,000 doesn't get us very close. So, I've shown this to some people before, but if we look at, we talk about herd immunity, and people start saying, okay, well, we're going to have herd immunity, so we're going to get out of this. So herd immunity means we have enough people that are immune that this virus doesn't transmit, doesn't circulate widely. You need a lot of people for that to be effective. For measles, it's 97%. The population has to be protected. That's why you get a little bit of drop in measles coverage, vaccination coverage in people, and you start to see outbreaks. This virus is hopefully lower, but even if it's at 2/3, if we got 71,000 and 2/3 is 25 million, we got a long way to go. Even if we say for every diagnosed case, there's 100 undiagnosed cases, because there are a lot undiagnosed, we're still well under that 67% threshold. So it's going to take time to get there. And what we want to do is get there through vaccination, not get there through disease. Because if we get there through disease by adding another 20 million infected people, there are a lot of people that are going to die in the process of this. And a vaccine isn't going to be available for a while. Vaccine, you're looking at maybe next year this time. People keep talking about 2020 is really unrealistic, even if we're pushing vaccine efforts really through. I think 2021, by the time you actually get a vaccine, it's shown to be safe and it's shown to be effective, and you produce enough and you actually administer it to everyone, which is a big challenge to actually get it. If you had 35 million doses of vaccine in Ottawa today, it's going to take a long time before everyone gets vaccinated. So we have to be thinking long-term in our distancing steps and our preventive measures, because we're not going to be able to say by July 1st, we've got enough people that are protected. And the other thing is, there's fatigue that comes in with this. We've been doing this for a while. It sucks, and we want to get back to normal, especially this summer. We want to get back to normal summer. And we're opening things up, which is good psychologically. But the thing to remember is, opening things up doesn't mean we're done or we're on the back end of this outbreak. It means there's room for you in the ICU. The big thing we're worried about is what happened in Italy and what happened in Spain and what happened in New York to some degree. Is you have people that need an ICU bed and people that need a ventilator and they don't have one because they're all occupied. And that's what we're trying to do. And you're going to see waxing and waning restrictions, right? As things get backed off, disease rates start to come up, ICU capacity start to come up. Okay, well, we're going to bring in a new range of restrictions for a few weeks to try to blunt that. So, we're not really trying to, we talk about blunting the curve. Well, we're really trying to blunt the waves because these are going to come up and down. Okay, so preparing for recovery. We're not getting back to normal in shelter operations or anything. We're going to get back to less abnormal, and then, hopefully over the course of a couple of years, get back to normalish. Ultimately, we're probably to be doing some things in a few years that are different because we may realize they're better overall, or realize some of the changes we had to do worked. So, we are seeing loosening or removal of restrictions. But we are going to have expectations on what can be done. And I think every industry, I think shelters are like that, veterinary medicine is like that. We need to show that we can do these things right because we have to anticipate there's going to be another round of restrictions. And the better we are at keeping our house in order, the easier it will be for us to say, if the next round of restrictions comes by, okay, we're good, leave us alone. We've been doing this really well. Compliance is really good. Our procedures are really good. We pose minimal risk by maintaining our core operations or all our operations. So go worry about someone else. So we need to be thinking about that. There are various reasons we want to do all this stuff and obviously protect human health right now, but we also want to protect different things. We want to protect the shelter. Right? If you get an infected person in the shelter, a staff member affects everyone else, your shelter's closed. If we get, concerned that we're not doing things right, next time there's a level of restrictions, okay, well, we're going to bring in restrictions on shelters or veterinary medicine or whatever because we can't trust them to do what we've asked them to do. Basically, it might be the approach from the government. So there are going to be expectations. It's not going to be a recipe book of here's what you have to do. It's concepts and it's approaches. And I'm going to come to some high level things for that in a couple minutes or less than a minute. I mentioned this before. It's a document we released last week or so. It's available on our Worms and Gerbs site through OVMA. It's designed for veterinary practices thinking about moving into the new normal, and just like 90% of it's directly applicable to shelters too. So I would encourage you to take a look at that. You can get some ideas on that. And essentially the approach that we took with that is saying, okay, what are the big areas we need to pay attention to? Because we're not going to get this recipe list of you have to do X, Y, and Z. It's going to be, we expect you to behave responsibly and ethically. So we've broken this in different areas: physical distancing or social distancing, whatever you want to call it. That is the key, right? Risk is created by human-human contact. So the more contacts we have and the closer they are and the less barriers that are involved, the greater the risk. And this comes into people coming into the shelter. It also comes into things like volunteers. If you have 100 volunteer hours that are serviced by 100 volunteers, that's a lot riskier than 100 volunteer hours serviced by 10. Every different person that comes in increases the risk. The more distant they are, the risk goes up. The worse they are with social distancing themselves, the risk goes up. The less we barrier those with things like masks, the risk goes up. So a lot of things we can think about, and I can't go over the whole package here, but thinking about everything we can do to distance, and that's, I'll come to examples, some waiting room, the lobby areas. It's how you walk through the clinic, how you have office space, how you flow people through, how you schedule things. Do people just show up or do you have everything by appointment? Alternate service delivery. So in veterinary medicine, we talk about telemedicine with shelters. As much as we can do by phone and by electronic sources without having to see a person, the better. Self-monitoring is a big one. We've been battling this for years, right? If you're sick, stay home, but people still have that mindset, I'm going to suck it up and I'm being a good worker by showing up even though I feel crappy. And like this should be the reminder that, thou shalt not come anywhere near the shelter or the workplace if you're not feeling right. The default is you don't think you're feeling right, stay at home. It will compromise, short staffing is an issue, but you're better off to be short staffed by one person for a day than to be shut down. And this is a real concern. I don't know any shelters that have been shut down from COVID. I know of multiple veterinary clinics that have been. One person was infected multiple staff. Everyone's been exposed, so everyone's been told they have to go home and self-isolate for 2 weeks. That shuts down the clinic. And if it's a shelter, think about, this is an exercise I tell people to do. Pick some random person in your shelter and say, okay, you've got COVID. And public health comes in the next day. Could you convince public health that not everyone has been exposed? because if you got an infected person, they've been in the clinic or in the shelter for a few days, the response might be all those contacts need to go home and self-isolate. And if you're not set up with your flow and your personal protective equipment and how you group people together, so you got groups that work together and groups that don't, if you run the risk of them just saying, okay, well, everyone's exposed because this is just a bit of a mess, your shelter's closed, right? So we've got to be able to do things to reduce risk of transmission in the back ends of the shelter, and to be able to provide, confident explanations why we don't have everyone exposed. Personal protective equipment, I've gone over that. Just routine things, cleaning and disinfection. Good general infection prevention and control, hand hygiene, all the routine things that we do. And then thinking about response to an infected employee or volunteer. So how do you get information, who they've been in contact with? The more people you have, the more transient they are, their work is, the rest structure they are in certain areas or groups they work with, the harder it is to track where they've been and who might have been exposed. So just a few examples, and we'll get into some questions shortly. Maximizing contact lists and curbside activities. Things that you're doing now, how much of that can we maintain, right? We can't maintain everything, but I think with all sectors, we're going to see more movement towards maintaining some of these things because people like them, they reduce the risk, we keep people out. The more you can keep people out of the shelter, the better. Look at your reception area. So maximum occupancy. A lot of shelters, it's going to be like 1, right? How many people can stand in your waiting area or your reception area and maintain a 2-meter distance? It's pretty small in a lot of areas. So thinking about, setting and enforcing occupancy numbers and how you maintain that, right? And so that's, instead of having an open door policy where all of a sudden you've got 4 people standing in the front and they can't distance each other and you're trying to deal with them at the same time, it's okay. You don't just walk into a shelter, you make an appointment before you come in. Barriers between staff and visitors. This might be, the ubiquitous, will be ubiquitous plexiglass barrier between your reception staff, and it might be other physical or procedural barriers such that you don't cross paths with people you don't need to cross paths with. So think about how you flow things through. Personnel and visitor flow, just how you go about your day-to-day activities, stepping back and thinking, what are the things that we can do to make sure that I don't run into someone else? Numbers and scheduling of volunteers, like I mentioned before, volunteers are important, but the more we can limit the numbers, the more we can improve communication with them, the better. Kind of choreographing various things. So interview processes, animal adopter visits, how are they done? Where are they done? How do we minimize the human contact that's involved there? I've mentioned this before, strict syndromic screening. So if you're sick, don't come near the place. And a process to do that doesn't mean taking their temperature when they show up, but a lot of it's just education, right? Here's why we need to do it. And the motivation, right? Maybe people, you may have a 20-some-year-old not worried about their health. But okay, well, you're worried about the animal health here. What happens if you get this virus and you spread it to someone else and we're closed? What's going to happen to the shelter of those animals? That might be the motivating factor. And things like routine PPE. Again, that might be routine mask, cloth mask use for everyone in the building. And part of it is, go to your grocery store, look at your grocery store and think about all the things that they do that you could do. It's barriers on the floor, it's plexiglass, it's flow certain directions. It's all these things they're doing to reduce those human-human contacts. And we can do some of those. And grocery stores are certainly at the forefront of a lot of this. So I think we'll pause for questions now. I've got some other questions there that some of them have been sent in we can go to, but we'll kind of go through the list if there's much there. Otherwise, I'll get to my others. Just before I get going with that, if you have any questions on just infectious disease stuff in general, but in particular COVID, don't be afraid to get a hold of me. I say put urgent in the title if it's urgent, to make sure I pay more attention to it. I get a lot of emails. If I see urgent, I'm going to jump to it right away though. So don't be afraid to contact me about these things. And I think we can just start in with some questions. Like I said, I've got some ones that we're sending in advance we can hit on, but we'll take a look at the chat thing.
So I think the first one's actually from, if we're going with the chat first, it would be from Linda. And she said, shelter protocols obviously will emphasize physical distancing and frequent hand washing. Beyond that, how often do you recommend to disinfect door handles and things like that? And do you have any protocols that you could share?
Yeah, there's not really a specific number you can say. More is better. I think a lot of it's looking at different sites and prioritizing them. Like, are floors a concern? Not really. You don't lick the floor, you don't put your face on the floor. We should clean. There are various things. But one of the things we need to remember is, this isn't the only infectious disease challenge. So we need to package what we're doing here into our overall infection control program and make sure we don't weaken other aspects of our infection control program dealing with this. But from a COVID aspect, from cleaning and disinfection, we're worried about human hand contact surfaces is the big thing. So, door handles are going to be something you want to pay more attention to. Countertops in areas that are busy. Lunchrooms where people are kind of crossing paths or taking turns, serially sitting in that spot. Every few hours isn't a bad thing to do. Depends on the surface. Like the more people can disinfect after they use a site, that's better because it gets done routinely. So if you're talking about a lunch table, that's kind of easy. The protocol is like when you're done, you disinfect it, or before you start, you disinfect it. For things like throughout the clinic, like your door handles, getting on a regular schedule makes sense. There's not really a standard thing. The more they're touched, the more often they should be disinfected. Your front door every few hours wouldn't be unreasonable, but you can't divert all your time to cleaning and disinfecting human hand contact surfaces and stop doing some of the other things that are important as well. So it's not a very good answer, I don't think, but I'm not sure there really is a good answer to it.
That helps. Thank you. The next one, I'm actually going to jump really quickly to a couple questions from our survey. The first one is talking about preparing to open a spay-neuter clinic. And normally in their cat housing ward, they say they can house 22 cats.
Yeah.
But with physical distancing, they can only house like 3.
Yeah.
And also with endotracheal tubes, circuits, rebreathing bags, should they be disinfecting them all between every patient? So there's kind of a 2-part question there.
Yeah, so I've got those up there on the slide here too for people that want to follow that. So physical distancing, when it comes to animals, who knows what it means? Like as a cat spreading things, like we need to keep cats 6 feet apart to prevent transmission of this virus. We don't really know. So I think if you're looking, again, it comes down to, there's only so much you can do, right? In the perfect world, you'd only have 1 animal in the shelter at a time, full stop, right? And you wouldn't have animals that come in with unknown statuses and everything else. And we just can't do that. So I think it's identifying high-risk situations and being particularly careful with high-risk situations. And then maybe not being not necessarily being as careful, but not taking as much precaution in the other. So if you've got someone coming in for spay-neuter, the big question is the health status of that household. If everyone in that household is healthy and the animal's been in that household for 14 days, that risk is really low. There's still some risk because of asymptomatic infection, but that has to be a person that's asymptomatically infected and infectious during that period of time, and they've exposed that cat, and that cat's become infected and is coming in with viral virus. Like, it's pretty unlikely. And that's why we wear normal PPE, and that's why we wash our hands and why we clean and disinfect routinely, right? It's to get those things that sneak through. So for a routine spay neuter, my focus is on the health status of where it's coming from. And like at this point, at least with the epidemiology in people, if the household is low risk and that animal's been there for a couple of weeks, I would just use normal practices. I would pay attention to using normal practices as well. But the biggest risk to the shelter is the person dropping that animal off. It's that human-human contact that happens there. So I would focus much more on how that human contact is done than I would worry about housing the animals while they're hanging out for spay-neuter. Now, if they're from a potentially infectious household, that changes. Then it needs to be isolation. And if you've got an animal that's coughing and sneezing, it's from a high-risk household, then yeah, I would rather have them 6 feet apart, because we don't know how far this virus could be spread by a sneezing cat. But in a normal situation, no. And it comes down to practicality, right? If you talk about turning 22 cat rooms into 3 cat rooms, it's not going to work, and we're going to have more downsides. So, but that's where that risk assessment for me comes in, realizing we can never make it no risk. Just like when I go to the grocery store yesterday, right? There's always some risk there, and I can only do so much with that. The next question about anesthetic equipment between each cat, I would do that as a routine thing anyway. Like I think ET tubes, anything that's contacting the mucous membrane, we should be cleaning and disinfecting between patients, full stop. Because there are lots of things we can transmit. And like, I'm not saying that from a COVID standpoint, I'm saying that from an everything else that causes disease in cats or dogs standpoint. Rebreathing bags are a little bit, hard. There's less risk from a rebreathing bag. It's farther away from the patient. From a high-risk patient, so you've got an animal that's got respiratory disease and an animal that's coming from a positive household, and you still have to do a procedure on it, I would absolutely get rid of those and want to sterilize those between use. Just for routine procedures, I would absolutely do endotracheal tubes. Anesthetic breathing lines are ideal to disinfect between each patient for sure. And rebreathing bags be lower on my list, but it's not a bad idea. It depends on flow and supplies and everything else, but ET tubes in particular are going to be high risk. If you're using those between patients, you are spreading things. I would have absolutely no doubt that you're spreading things. You may not know about it, but you are going to be spreading things.
Okay, so Isabel asked, as long as you can respect social distancing, are the nature of the activities relevant? So can the shelter accept healthy kittens, for example? A pause was doable for a few weeks, but it's taking a few months now.
Yep. Well, we have to get on with life, right? This isn't, again, if this is something where we said it was going to be over in 5 days from now, we're done, we'd say, okay, just shut down for 5 more days. It's not. This is going on for a year plus. So we need to figure out how to function. A healthy kitten is going to be exceptionally low risk, right? Again, it's that screening. Where's the animal coming from? An animal coming from a household where someone just went to the hospital because they were sick and had respiratory disease and maybe had COVID, that's a high risk thing. I think shelters can still take them if you've got the ability and the confidence to handle a higher risk patient. Isolation, personal protective equipment, everything else. Kittens, healthy kittens coming in, again, screening the household. If they're not coming in from a known high risk household, I would have no problem. I would just, it's a good time to reinforce all the routine infection control stuff that we're doing. I guess the question below that, maybe I'll just move on to another kitten question. Is it advisable to hold stray cats or kittens at the shelter 14 days prior to placing in foster care? From a COVID standpoint, yes, it does, because then we can say to the foster there's no risk. Does it make sense in the grand scheme is where you need its cost benefit, right? There's going to be a bit of benefit there. It's probably going to be a limited benefit depending where the animal's coming from. So if the animal's coming from a high risk situation, I would say absolutely shelter it so you don't send it into a foster and expose the foster. If you've got someone that, there was a barn full of kittens and they brought them into the shelter, what are the odds those kittens have been exposed? Exceptionally low. I would get them out of the shelter because that's better for them overall. And they're less likely to get sick. We're less likely to use an antibiotic. We're probably, from a human health standpoint, getting them out of the shelter for resistance concerns because of the antibiotic use is a big thing to talk about there. So again, it's risk assessment. If it's a situation where we don't think the risk of those animals being exposed is plausible, treat them as normal. If we think it's plausible, then we bring in the isolation. Like a second part of that, or if there's no known contact with COVID positives and presented healthy, could they place? Yeah. So I guess what we said, yeah, I would assess them. If I don't think there's a realistic COVID exposure risk, I would put them into foster. And I think the other big thing about fosters is really talking to them about their health status. So I can tell you personally, I'm adopting a kitten maybe in the next day or two when it comes back from foster. So I have no concerns about bringing COVID in the household if, and this is the if, that they tell me that the foster is healthy. It doesn't negate that risk completely because that foster could have an asymptomatic infection, but it's all I can do, right? If I want to adopt a kitten through a shelter, that's what I'm gonna have to do. So having good communications with the fosters, making sure they know to be open about their health status. And if they have any concerns at all that they might be infected, then animals don't leave that foster until you sort the situation out. But if they're clinically normal, we accept there's some small degree of risk, and I think move them between fosters and shelters as per normal.
Okay, the next question there is, what product do you recommend for disinfection of surfaces?
So I guess there are two parts to this. One is for this virus and one is in general. Anything will kill this virus. The biggest issue with killing this virus isn't what disinfectant you use, it's actually doing something. So cleaner will kill this virus probably. It's a really susceptible virus. That said, I like accelerated hydrogen peroxide because I want to be able to kill parvo and everything else that's there. And I want something that has, short contact time, environmentally friendly, able to work in the presence of organic debris. So I'd rather use the best disinfectant I have. Although if you're just focusing on this virus, pretty much anything will do it. But since we can't lose sight that there are other things that we're worried about. You can't say, okay, I can use something that's really cheap because it'll kill this virus really easily. Well, I want to make sure we don't run into other problems. So I would still stick with accelerated hydrogen peroxide as my standard. A couple other questions. So the dentistry question comes up, and it depends how many of you do a lot of dentistries. Dentistries they're a tough area. Dentistries are the highest risk things that we do for exposure to an aerosol pathogen, right? We're in their face, intubating them, we're working within close proximity, we're aerosolizing things with dental instruments. This is going to change how we do veterinary dentistry, I think. For years we've recommended using precautions in dentistry like a mask and eye protection. we've always said it, some people do it, most people don't. This is maybe going to move us towards more people doing that. So again, it's the risk assessment. If you've got a cat that's coming in from a household where it might have been exposed to COVID, I would not do a dental on it unless it absolutely had to. And if I did, it'd be with an N95 and a face shield, probably with goggles underneath that in a confined area and the whole hog approach to it. That's a high risk situation. If I got a cat, susceptible species, and it's not a high risk situation that we know about, I would still want to use a surgical mask and a face shield at a minimum, because we don't know that there's no risk. And since we can do something like that really easy, it's easy and it's cheap to wear a surgical mask and a face shield. Once you get used to it, it doesn't bog down doing the procedure. And since aerosolizing stuff from the faces of cats is going to be our highest risk exposure, it makes sense to do it. Plus, there are probably occupational infections that occur from dentals all the time. We just don't know about. People probably get ocular infections not uncommonly because they're aerosolizing Pasteurella and things that get into their eyes. We just haven't paid attention to it. So I think this is something that we should just be doing as a routine thing. But again, flagging the highest risk case. And if it's really high risk case, either don't do it or do it with a really high level of precautions. Do you have any other ones there you want me to hit, or?
I think you've actually covered them. That's all that's in the chat window. Does anyone else have any other questions to add to this?
There's one here about, I guess maybe some of these are more comments, I guess. So I think one of the things for shelters is, like, we're in Ontario, we're getting back to business as usual in terms of what we can do, but it's not business as usual as how we do it. I think that's really the take home. There's a comment there about prioritizing animals. I think that's really going to be a key for spay neuters, because you're going to have a big backlog, and prioritizing the situations will be important so we can maintain just that normal infection control. But I think one of the big take homes for me is, step back and think about your shelter like a grocery store. Step back and watch what happens in your shelter. Think about every human contact that happens in your shelter, and does it have to happen? Like, if you're walking by someone 30 times a day, is there a way you can prevent that just by how you move people through the shelter, or how you position them? We're not going to prevent all contacts by any means, but the more we can reduce them, the greater protection we're going to have. Comment about the survival of the virus and fur is more likely to be in the range of a few hours than a few days. Yeah, it's probably in the minutes to hours. On some surfaces it can last a couple of days, but I don't think that's probably relatable to a hair coat. So I would think hours would be more likely the situation. Comment about donated newspapers for shelters as bedding or base material. There are a whole range of theoretical risks. So how long is the virus going to live on a newspaper? Probably more into the hours than days based on that type of material, I would suspect. So the risk of it being contaminated by the time it gets to you is pretty low. So if someone's infected and they touch the newspaper and you touch it right after, yeah, there's a theoretical risk. And you can reduce that by, if they bring the news, if you're really worried about it, you bring the newspaper in, you don't touch it for a couple of days. Again, this comes down to health status, right? Anyone that's coming into your shelter, anyone that's doing anything in your shelter, whether it's a food company record, it's a drug rep, or it's a volunteer, it's a co-op student, it's someone bringing in something, if we can screen their health status, someone's dropping off newspaper. Are you healthy? Yes. Okay, great. Are you not healthy? No. Well, maybe come back next time, or dump your newspaper in this thing out back, and we'll get to it in a couple of days. Like, that's going to negate that risk. So again, we're going to have to get used to, as a society, getting asked if we're healthy all the time, because that's what we need to do to identify the higher risk situations right now. Right? That may change, but right now, that's what we're going to have to do. There's something we're talking about months to years now. If social distancing can be respected, is routine spay neuter okay? Yeah, and I think it is. Like, inherently, one of the concerns about doing some things like spay neuter 2 months ago was the PPE shortage, right? Big concerns about diverting any type of PPE to veterinary medicine that could be used in human healthcare. As human healthcare is in a better situation now with their PPE, and it's not really as much of a concern that we're using gloves and masks in our procedures. Like a spay neuter, if the animal's in the shelter, spaying or neutering it creates no added COVID risk versus feeding it, right? Yeah, we get a little more contact with it, but overall, we're not, it's when you start bringing people into the mix, that's when it gets. So if you got a high volume, lots of people coming in and out of your shelter, yeah, that's going to increase the risk. And that's when you really need to think about the human side. So how do we minimize people? So again, scheduling it, so, one person there at a time. It should be such that, visitors don't cross paths with each other, and your staff don't cross paths with visitors except for very controlled situations where they've got PPE or a physical barrier. So I don't think there's any reason we shouldn't be doing spays and neuters at this point now that Ontario's changed the restrictions on that, as long as we can take the measures to reduce that, which means maintaining social distancing. How are we doing on questions? Anything new? Some are just good comments back and forth.
So Debbie's asking about drug shortages. Do we still have to be worried about that, even though the PPE is looking better, or are the drugs still a concern?
Well, drugs haven't, there've been concerns about drug shortages. They haven't played out much as far as, at least as I've seen. A lot of the drug shortage issues in human medicine have been things that we don't tend to use much. A lot of them are things like paralytics used for ventilator patients and stuff like that. And some of the antibiotics that they use that are antibiotics we don't typically use. We had a lot of concern earlier when China was really affected and what might happen in India, because that's where most of the manufacturing is done. So I think we've seen some sporadic shortages, but I'm not sure we've seen that much out of the realm of normal. Like, we're always seeing stuff going back order. So I think right now there doesn't seem to be a major, at least from my experience, and I'm not tuned into buying all the drugs, I don't think we're encountering much in the way of drug shortages. If people are seeing that, I'd be interested, but I think we're in a pretty good position right now. And a lot of that, and this is just a broader, it's a good comment or a good thing to bring up. I think you really need to be aware of all your supplies. Like PPE is a big one. My watch is talking to me. PPE is a big one. You need to know what your PPE supplies are and your surgical mask supplies are. Because we start thinking about reusing or extended use or using cloth masks instead, because, you know, if you know you're down to 20 surgical masks and you're not getting any for the next 2 months, we need to think about whether you're going to do fewer surgeries or use alternative approaches. And the same thing comes in with drugs. So I think just being aware of these, and shortages may come and go. And we have to keep an eye on that internationally, because a lot of our drugs, well, most of our drugs are sourced internationally. So if things flare up somewhere else, we think maybe stable and going really well here, but we may run into some shortages because a lot of production of most things is overseas. Various things, just information, good information being exchanged there. I don't know if there are any other questions. Have you seen any other questions, or are we?
I haven't seen any more questions, so maybe we'll just give it another minute. If anyone has another question, we have about another minute, we can accept them.
I think maybe I'm just going to the other questions that came in. I think we've maybe covered them all pretty well. Anyway, messaging to the public around the concerns of adopting a pet that's been to a foster home, ensuring that's not been exposed to COVID. That's my exact situation with adopting this kitten. I think it's just a matter of we're in good communication with our fosters. We have specific guidelines in place to monitor their health, which we should have, right, if you have that. And we're doing all we can to make sure that the fosters are healthy. And that's really all you can say. You can't guarantee, and would never have you say that the fosters don't have COVID, because you can never say that. But all you can say is they're healthy, they're not self-isolating. Here are the criteria we have for bringing an animal back from a foster. So the foster household doesn't have anyone that's positive, doesn't have anyone that's being self-isolated, and that's pretty much it. It's anyone in the household. So that's something that's pretty easy to put together, and it is a good communication to have with your fosters to make sure they know the expectations there, because they may not be thinking about it, because they may think, okay, well, someone can, I can put the kitten on the doorstep in a carrier and someone can come and get it, and I haven't had contact with them. Well, it's true, but the kitten still could pass things along. Oops.
Thank you so much, Dr. Weese. We really appreciate you taking the time to speak with us. We know your time is so valuable, especially right now, and we greatly appreciate it, and we've all learned so much. So thank you so much.
Great, thanks a lot. There's my email again, if you can still see the screen. So don't be afraid to follow up if you have any questions. Thanks a lot.
Thank you.